From NBC News, this is Today.
Back now at 7:42, women of America, you may want to stop what you're doing and listen to this. There is a brand new way for women to fight cellulite, and some doctors are calling it revolutionary. Natalie Morales is joining us with details. Hey, Natalie.
Well, Ann, as you know, there are all kinds of treatments and creams that claim to get rid of cellulite, but some doctors say this new procedure is unlike anything they've seen before. And we got an up-close look at how it works.
You're looking at the latest tool in the fight against cellulite. It's called Cellulaze, recently approved by the FDA. Doctors use a tiny laser to target cellulite under the surface of the skin. Dr. Bruce Katz participated in clinical trials at his New York City office.
For the first time, with one simple treatment, we get long-lasting results, very safely performed, and quick recovery. This is the anesthetic going in.
The procedure begins with a local anesthetic, so the patient is awake the entire time. Once the area is numb, Dr. Katz inserts a tiny laser under the skin. It's a three-step process. The laser heats the skin and actually melts the fat. Then it cuts through the bands that pull the skin down to create the dimpled effect. Finally, the laser heats the skin to enable the growth of new collagen, which the company says increases elasticity.
Usually in several weeks, you start seeing those bumps and valleys go away.
After the procedure, Dr. Katz says the patient may experience soreness and bruising. Most can go back to work the next day. The company says the results can last 1 year or more, but it's too early to measure the long-term effects.
We think it's possible that it may come back if people gain weight or stop exercising, but I think if they've stayed clear for 2 years, we will get lasting results for many years to come.
35-year-old Joanna Patrique is a physician's assistant in Queens, New York. She had the procedure in the fall of 2010 as part of the clinical trials. The result?
Amazing. Yeah, it was awesome, actually. It was nice to actually look in the mirror and not feel so self-conscious about something that had bothered me probably for a good 20 years.
Buzz about Cellulaze is already spreading. Harper's Bazaar takes a closer look at the procedure in its May issue.
The data I've seen from Cellulaze is certainly the most impressive data I've seen on a cellulite treatment ever. It is what we call a game changer in the business.
For Joanna Patrique, Cellulaze was the answer to years of insecurity about her thighs.
They're dimpleless, which to me is perfect.
So, ladies, I know you're all wondering, what does it cost? Well, Dr. Katz says Cellulaze is about $2,500 and up, depending on the area you want treated. And
all right, Natalie Morales, thank you. Well, Dr. Bruce Katz, the director of the Juva Skin and Laser Center in New York, is joining us, along with Dr. Nancy Seiderman. Good morning to both of you.
Morning.
So first of all, we should say that cellulite is not a disease. It's something that's a common, normal characteristic of between, what, 80 and 90% of women?
Yes, I think when we toss out the word cure, I guess I'm approaching this as a cancer surgeon. I always think, well, it's not cancer. So we don't talk about cure, we talk about long-term results of a cosmetic problem.
That's right. And this treatment, now we just got an idea of how it works. Can you give us a sense about how long we think it's effective and why we think it might be effective beyond maybe a year or 2 years?
Well, we've been doing this for about 2 years now, and we think if the cellulite hasn't come back in 2 years, it's probably going to be pretty much permanent. But we have to wait and see, because that's only been our experience so far.
This procedure is invasive. It requires anesthesia, local anesthesia. Are there side effects, Nancy?
Well, it's very safe. I should say there are other techniques that have been FDA approved. They just haven't worked very well. That means the long-term results haven't been so great. But today, I have to say most cosmetic procedures are unbelievably safe. Local anesthesia, very minimal risks, infection rate hardly anything. I think the biggest risk, frankly, is people may not think that all their cellulite has gone away.
Yeah, I mean, the worst side effect we've seen is minimal bruising and swelling.
And that's temporary.
And nothing else.
Yeah, so I'm not worried about the safety thing. I think the big question for women is it worth it for me? Do I really want to change? And then the cost, because this is not going to be covered by insurance.
Right, not covered by insurance, $2,500 I just heard.
Minimal.
Minimal, because that's just for what, doctor?
That's usually one area, but you know, if you compare it to current treatments where you have to come back 6, 8, or 10 times, the cost is pretty comparable.
When you say one area, do you mean the thigh, or do you mean one point in the thigh?
Like the thighs, one area is the abdomen, the butt is another area. So
you could spend
common area.
$8,000 depending on where you're carrying this and how much you're carrying.
You could, yeah, you could, or upward. And I think it's important for women to remember that cellulite really is a part of a woman's anatomy, whether it's heredity, aging, hormones. The skin is connected to the muscle with these little fibrous bands. It's a little bit like your mattress and where those buttons are placed. And then fat cells get caught in between. So liquefying the fat, cutting those fibers,
that's very important.
those bands.
Yes.
You know, the whole idea is to sort of smooth out the skin.
Because it's not about whether you exercise enough. It's not about your diet. It's just really what you've inherited.
Well, skinny women can have cellulite.
I've had triathletes and marathon runners who have cellulite, and we've treated successfully.
I think the biggest thing is it worth it for you? And if so, at least make sure you're going to someone reputable and you've done your homework.
Dr. Bruce Katz and Dr. Nancy Snyderman, thank you for helping us do our homework. And still ahead this morning, a woman who's given birth 15 times.